Assalamu alaikum. This is a case where the student was working with adjusting teeth. Okay, she was adjusting the teeth to increase the bite. The reason why there was more bite on one side than the other, when we removed the tri-end denture, there was wax on the cast. Once she cleaned it, now she can see the spaces in between. While she was sitting, she was asking about first this tooth. Do I put it in between teeth? Yes, the answer is yes, because the embrasure of the lower, the two teeth embrasure between them protects the cusp, so it will not be high. The ideal position for a tooth is to be in between two marginal ridges of the opposing teeth. Okay, so the cusp should meet two marginal ridges opposing to it. So you can reduce the canine a little bit distally, okay, and move this into the embrasure correctly to meet the mesial embrasure as well. Okay. Second question was this tooth. Do I need to move it buccally? And this many times happen. Do you see that the molar here on the mesial root, the mesial cusp is like almost a scissor bite with the one opposite to it. Now you have the ability to move it. So move it how much? You need a full cusp away from the tooth. So the cusp of the lower should be in the central groove, and the rest of the upper tooth or the opposing tooth should be outer than that. That creates what we call a buccal overjet. So the overjet, not anterior, it's a buccal one. What happens if I leave this? And it once happened when I missed a tooth being like this in a denture, and I delivered the denture. The patient came back saying that I'm biting my cheek, especially in the buccal pad. You remember that a lot of fat is there. So it will go in between. This will not prevent it. The reason why do we have a buccal overjet, meaning the buccal teeth, the palatal cusps are inwards and the upper buccal cusps are outwards, functional and non-functional, is to protect the tissue from biting. Okay, so if I deliver this, the patient will come back biting on his cheek. How do I adjust it? In the case here, you can adjust it with moving wax. The case, in my case, what did I do? The denture was processed, and I have a tooth with this type of occlusion. I did not notice it. What do? You add composite, you acid etch it. By the way, composite binds to these teeth excellently. Yeah. Acid etch, clean wax first, acid etch, bond, and then add a drop of flowable composite, creating a buccal bulge. So that buccal bulge on the distal, on the mesial, in my case, the one previously, I added distal and mesial. In your case, if somebody delivered something like this and you want to adjust it, add mesially. But here, because we are in the trial, do it in wax. Move it. But it could be solvable even in complete dentures that have been delivered and processed. So add composite to add this bulk and prevent the scissor biting on the cheeks. Thank you.